This segment is sponsored by Maryland Vascular Specialists.
Today we're visiting Maryland Vascular Specialists, the area's leader in artery and vein health. Now, as a premier outpatient vascular care provider, they're dedicated exclusively to the care of artery and vein disorders related to the circulatory system. So joining us today is Dr. David Cole, vascular surgeon. All right, well, thank you so much. So what do vascular surgeons specialize in?
So we essentially treat arteries and veins outside of the chest. So any vessel outside the chest that requires an intervention or evaluation, that's essentially our box that we operate in.
And what kind of education and training is required to become a vascular surgeon?
So when I grew up, it was a general surgery residency of 5 years and then 2 years of vascular surgery. Now you can actually go directly into vascular surgery. Usually it involves 6 years after medical school.
Okay, now what are some of the most common conditions that you guys treat here?
We treat probably more commonly people that come with venous disease or varicose veins in the legs or problems with the blood flow return from the lower extremity. But we also treat diseases in the carotid artery, which are arteries in the neck that can cause stroke. We treat blockages in arteries of the legs that can cause you to have trouble when you're walking. And we also treat diseases of the aorta in the abdomen, aneurysmal disease.
So what really makes MVS stand out from other treatment providers?
I think it's the ability that we have to treat a lot of the diseases in the office. Many of the vein treatments that we do can be done in an office-based procedure just under local anesthesia. And then any type of intervention in the peripheral circulation or arteries of the legs can be done here under local and sedation and avoid going to the hospital for treatment.
And that has to be amazing for your patients, especially during this time, right?
Exactly. And the other thing is that that's all we do. So it's different. That's what I try to relay to patients. In a hospital, they're very good at what they do. I work in the hospital every day, but they treat every kind of disease in the hospital. Here, we just treat vascular disease. So everybody here is a specialist in vascular disease.
And so that has to be extra comforting for people
Correct.
who have COVID concerns.
No, for COVID for sure, just because the exposure's down, yeah.
Okay, so when do people know it's time for them to see a vascular surgeon?
So if you have any difficulty with pain in your legs when you walk, if you've had any symptoms that are associated with stroke or symptoms of stroke, and then again, more commonly, leg swelling, varicose veins, discoloration in the legs, those kind of things.
And are all of MVS providers board certified?
The majority of our providers are board certified, yes, in vascular surgery.
All right, well, thank you again for taking the time with us today, Dr. Cole. Truly appreciate it. Now, if you'd like more information about Maryland Vascular Specialists, please visit MVSDoctor.com.